Time once again for a look at what is making headlines in the field of heart health. Joining me in studio today to talk about a new heart attack test available for patients is Baptist Memphis Emergency Department physician, Dr. Paul Sheehan. Dr. Sheehan, welcome to Smart Medicine.
Thanks for having me.
And let's talk about this new heart test. What is it?
This heart test is looking at patients that have come in complaining of chest pain. And obviously one of the things we really want to make sure of is quickly determining whether they're having a heart attack or not. A lot of the times people will get an EKG, which takes an electrical picture of the heart and will show some types of heart attacks, and we can diagnose that within minutes of somebody coming into the emergency department. However, only about 50% of the time will an EKG show abnormalities suggestive of a heart attack, even in someone that's having one. And thus we're forced to rely on slower tests such as blood tests to look to see if there's been damage to the heart. The advantage of this new test is, unlike previous where we'd have to go to draw blood, send the blood up to the lab, it would take hour and 15 minutes, and depending on when someone came in, that first test may not be positive because there hasn't been enough time for the enzyme we're testing for to show up in the blood. This new test is able to be run at the bedside within 15 minutes or so, and we can get that information back very quickly.
Okay, doctor, how does this benefit patients?
Well, it benefits patients by enabling them to be diagnosed sooner with a heart attack. And the sooner we diagnose you, time is muscle, and so we can save more of the heart. This blood test is designed to check to see if there's been damage to the heart. This is run right at the patient's bedside, is available within 15 minutes, and if somebody does have damage to their heart based on this test, then we're able to get them to the cath lab to open up the blood vessel that's blocked or start them on medications to help prevent further blockage much sooner than we would have traditionally.
Have you seen improvements in your patients?
I have. Actually, the last shift I worked, there were 2 patients that came in that had pretty good stories for this being a heart attack, but we weren't certain. Their EKGs, the electrical picture of the heart, didn't show anything terribly remarkable. The first set of cardiac markers is negative, and this was on a Friday, so what would traditionally have happened would have been they would have been admitted up to the floor, they would have gotten serial cardiac markers, and potentially if they did have a heart attack would have been treated at the cath lab Monday or 2 or 3 days later. Because of the fact that we got these second cardiac markers and showed that both of the patients were having heart attacks 2 o'clock on a Friday, both of them were able to go to the cath lab and get the vessels that were narrowed fixed, and that helped prevent damage to their heart, which means they're going to have more functional ability because they're going to have more heart muscle to work with for the rest of their life.
All right. Dr. Paul Sheehan, thank you so much for joining us here on Heart of the Matter.